next. We are a few minutes in, and so I want to honor everyone's time. You know, I'd like to end on time if I can. We have a lot of content as usual to cover. So what I'm gonna do is let me get ready to share my screen and then run you through the evening. Okay, I'm gonna share my screen.
Are we going to talk about that new variant?
We sure are. We will have a discussion and share as much information as we possibly can with you,
Okay.
at least of what exists at this particular point in time and that we have access to.
Okay.
All righty, so everybody can see the screen. You're comfortable. I have enough faces over here. Welcome to our childcare check-in for December 2021. Now, if you want to move, you can move. Okay, so this is your welcome. You know that we have translation available both in Spanish and in Chinese. Hopefully you're familiar. There will be a globe at the bottom. The directions are here in English and Spanish. And we have translators if you're not already tuned into that channel. And this is your Chinese text. So get yourself situated in the language that feels most comfortable for you this evening. I think many of you are still familiar with the housekeeping rules. We're recording this session. It helps us kind of inform and take some notes and anything that we have to bring back or explore a little bit more. Attendees, you should be muted already. Just please be mindful of, you know, when other people are talking, we have a lot of background noise. And then submit your questions in chat. My esteemed colleague, Michelle, will be monitoring the chat. She'll help navigate those questions for you with all the presenters. And then, you know, you guys are respectful, so feel free to unmute yourself and ask questions as you need. There will be designated time for that. Okay, for tonight's featured discussion, we have a bit about COVID-19, the vaccine and the booster updates. There'll be some discussion related to the Omicron variant. There are rate increases coming to childcare providers related to subsidies on January 1st of 2022. So we'll have some discussion on what to expect related to payments. There's a number of resources that we want to share with you, go through that. And then because this is technically our final session, we're going to do a little bit of a poll and discussion of like what happens, what's the, you know, how do we evolve with these check-ins, or do we at all? And then we'll wrap up and bid you all adieu for the evening. These are our lovely presenters for this evening. Dr. Noemi Spinazzi from UCSF Benioff Children's Hospital will be giving our presentation. We do have Public Health Healthcare Services Agency, our beloved Lisa, who we join and say a few words. Vincent will give you a little bit of information on the rate increases and what to expect January. And then Michelle will give you a little bit of information on Health Heroes. All right, first up, we have Dr. Noemi. She's been fabulous. She's been doing some work with our public health department. And so I wanna introduce Dr. Noemi and then let's get going from there. Welcome, Dr. Noemi.
Thank you so much. Will you be sharing my slides or should I share my screen?
No, I got you all set.
Cool. Nice to meet you, everyone. My name is Noemi, and I'm a pediatrician at Children's Oakland. I have been doing work around safe learning, safe in-person learning, and around COVID-19 awareness and safety, and of course, the vaccine. Next slide, please. Next slide, please. Oh, sorry. I think there's a bit of a delay. Go back, please. Great. I want to review what my values are, and the values that ground me and the values that ground any presentation that I give. I ground myself in the value of transparency. I'm going to tell you what I know. I'm going to tell you what I don't know. I'm going to tell you the truth, even when the truth is sometimes inconsistent with something that I might have just said. I'm going to make it as accessible as possible, and I'm going to share with you the limits of what we know, as well as the extent of how much we know. I believe in safety, and I don't believe just in my safety, but in my community's safety. And I do believe that we are each other's keepers and that we keep each other safe. We strive for racial equity. And when we talk about COVID-19 and the pandemic, we have to keep the importance of racial inequity in mind when we think about the impact of the pandemic on our community. I believe in collaboration with the goal of empowering each other and empowering our communities. And I believe in recovering and resilience. And I think that everyone on this call has been so incredibly resilient. And we have all been working together to help our community recover from this terrible pandemic. Next slide, please. I also think that we tend to have shared goals, and I think it's important to remember what those shared goals are. I would say that most, if not all of us, want to keep our families safe and healthy. We want to protect each other and protect our community, and we want to keep our children safe from harm. And I hope we can all agree that these are shared goals that we can keep in mind as we think about COVID-19 and how to stay safe from it. Next slide, please. And also, I just want us all to think about the fact that there has been rampant, widespread misinformation that has disproportionately impacted the same communities that have been disproportionately impacted by the pandemic. I hope that as part of the new normal, to quote Marcela Núñez-Smith, we can really restore trust in science and evidence and data by being transparent and sharing high quality information. Next slide, please. So the first few slides, you're going to hear me say next slide a whole bunch because I want to zip through them. You already know this. I go through them again anyway because it is important to remember that even if we're going to talk about the vaccine for the most part tonight, we are talking about a Swiss cheese model of defense where we have multiple layers of safety, and when we superimpose them one on the other, we seal up the holes that each of these layers has inherently. Next slide, please. So we're still going to wear a mask. Masks really work to decrease the spread of COVID-19. We have to wear it all the time, and we have to wear it correctly. We have to wear it over our nose and our mouth. If we have it under our nose, then one, it's not keeping the particles that come out of our nose from going out into the air. And two, it's not protecting your nose from breathing in someone else's particles that could be infectious. So the mask has to be worn correctly to work. And then let's help each other out. If my mask has slid down, please remind me to pull it back up. Please remind me if I forgot to put it back up after eating or drinking. It is by reminding each other that we keep each other safe and healthy. Next slide, please. This is really important, and for childcare providers and emergency respondents, this is so big, right? Because as childcare providers, oh my gosh, all kids are sick all the time. And so it's really hard to say stay home is sick when kids have a runny nose all the time. But it's really, really true and really, really important because when kids have COVID, a lot of the time it does look just like a cold. And so if a student has any symptom within the past 24 hours that could be attributed to COVID, and that's runny nose, fever, cough, upset stomach, headache, loss or taste of smell, any other symptom that could be attributable to COVID, stay home. Same with staff. I am the first to admit that before this pandemic, it took being hit by a truck to not go to work because work is really important to me. This is the time where we're actually more helpful if we stay home when we're sick and get tested before returning to work. Of course, if anybody at home has COVID, we're supposed to quarantine. And if you've been told to quarantine by a doctor, you should stay home. And if you're waiting for the result of a COVID test, unless it was a routine test before a surgery or something like that, then you should stay home. Next slide, please. And when in doubt, get tested. When should we get tested? Of course, if there's been a confirmed exposure to COVID-19. If there's a household contact with COVID-19, of course, we're going to get tested. And then any symptom that could be due to COVID-19 should prompt a test. I want to acknowledge a question in the chat. What if you have IBS? Oh my God, this is the story of my life. I have IBS and I get upset stomach Monday through Friday because I get it when I'm stressed, and especially in the morning because that's when I'm stressed. What I would say is that's not a new symptom. That's your chronic symptom, right? And so we're talking about new symptoms. So if you're like me and you have an upset stomach every morning, then it's probably not necessary to do a test every day. But if you get an upset stomach most mornings, because that's how you present with your stress, and then one morning it feels different and maybe you're throwing up uncontrollably, or maybe you have an upset stomach and a fever or body aches, then that feels different and new, and that should prompt a test. That's a great question. Which test to use? The PCR, that's the one that they might do at this drive-through testing sites and at the hospital. Those are more accurate, but it takes a little bit longer for the result to come back. We are lucky to have some pretty good rapid tests. The Binax by Abbott, for example, is up to 95% sensitive at picking up infections. So if you need an answer fast, then using a rapid test is acceptable, especially if you have symptoms. I'll tell you, I really wanted to see my family for Thanksgiving, and I made everybody do a rapid test for a couple of days before Thanksgiving, including the day of Thanksgiving. And then I felt a lot more comfortable about gathering with other people. Next slide, please. And Walmart has them cheaper than Walgreens, and they deliver. Hand hygiene is really important. Deep disinfection of all the surfaces is neither helpful nor particularly practical, because you disinfect something and then a second later someone touches it and then you're back to square one, versus if you're cleaning your hands and you're doing that before touching your nose and mouth, especially before and after eating and using the bathroom, that you get a lot more bang for your buck. High touch surfaces like doorknobs and light switches, your phone, that's really worthwhile doing more frequently. A keyboard that is shared, I'm notorious for when I get to work, I disinfect the keyboard and I disinfect the phone receiver. Next slide. Ventilation and filtration are two ways of cleaning air, right? Ventilation means that there's air exchange. Filtration means that the air goes through a filter that cleans it. And both of these are effective ways of decreasing COVID transmission. Opening a window improves air ventilation a lot. And so that is a very quick and easy thing that we can do as much as possible. Classrooms, especially in school districts, have had a lot of air purifiers installed that disinfect the air. And then whenever possible, especially in our personal lives, let's gather outdoors. That's definitely how I have compromised my desire to see my friends with my healthy fear of COVID. It has been by choosing to gather outdoors. And I'm noticing a question that has to do with what if my skin has an allergy to hand sanitizer? There are some that are just pure alcohol, and it's unlikely for you to have an allergy to the alcohol part. It's probably something in the preservative or the perfumes. So you could try the strictly alcohol ones. You want to have at least 70%, although those dry out the skin quite a bit and you should moisturize. Or you could elect to wash your hands more often with an unscented soap, and then definitely reapply moisturizer often. I have dry skin too. Next slide, please. And so one more question, should windows be closed and filters on with smoky air, or is it okay to leave windows open? That actually came up this summer as I was going through the schools. And I think it depends on the air quality, and it depends on how often, long you're gonna keep them open. If you have good air filters in the classroom and the air quality is above 150, then it's probably worth keeping the windows closed, especially if it's a time when students are wearing their masks, and then you might wanna open them just around the time that kids have their mask down while they're eating. That could be a compromise between wanting to not be exposed to bad air quality and wanting to improve ventilation. Also, if you face your fan outwards, then it's going to blow the air out without necessarily bringing as much of the air in, and that's also another compromise. There's often no perfect answer. There's just the best answer for this moment, and that's a very frustrating part of the time that we're living through. So I want to switch gear for the sake of time and talk about the vaccine. And I want to start from the very start, which is what is a vaccine? Because I actually find that there's enough questions about this that it's worth reviewing. A vaccine is like a school lesson for the body's defense system. What it does is it teaches the body to recognize a germ before we ever come in contact with it. I'll give you an example. If I tell you Denzel Washington, I bet that probably most, if not all of you, had the picture of Denzel Washington in your mind. That's a nice thought. How many of us have actually met Denzel Washington, right? Most probably none of us, or very few of us. So the vaccine is kind of similar. I'm teaching the body how to recognize the virus, how to recognize Denzel without ever coming in contact with it, so that when and if my body actually does come in contact with COVID-19, then I can recognize it and I know how to fight against it. The COVID-19 vaccines, the Pfizer, Moderna, and even the Johnson & Johnson in a slightly different way, what they do is they teach the body to recognize a specific part of the virus called the spike protein that's on the outside of the virus. And then the immune system needs some time to learn the lesson. And that's why we consider someone to be fully immune 2 weeks after they got their second dose of the Pfizer or Moderna vaccine, or 2 weeks after their Johnson & Johnson dose. Next slide, please. Can you all hear the beeping from my oven? Excellent, then I'll keep going. So far, there are 3 COVID-19 vaccines that are approved in the United States: Pfizer, Moderna, and Johnson & Johnson. Pfizer and Moderna are very similar in what they do. They have a tiny piece of mRNA, which is instructions for the body to make the spike protein. And so our own body then takes responsibility for making the protein. It's a 2-dose vaccine. Pfizer, the 2 doses are 21 days apart at least. If it's a little bit more, that's okay. If it happened on a weekend and it got delayed by a couple of days, or your appointment got canceled and it happens to happen a week longer than 21 days, that's really okay. It just cannot be any sooner than 21 days. And then for Moderna, it's 4 weeks apart. They are approved for people over 18 for Moderna, and finally, for kids over 5 for Pfizer. My baby is 7 months old, and I have a strong desire to dress her up as a 5-year-old because I'm so excited that there is a vaccine available for 5-year-olds, and really jealous that one is not yet available for babies. For both of these vaccines, it is now recommended that all adults over 18 receive a booster 6 months after the second dose. Why? Because it looks like the immunity starts to wane a little bit after 6 months, and so we want to boost it back up. It's like as if you'd seen Denzel Washington, but it had been a while since you'd seen a movie by Denzel, and so you're like, let me go watch another movie just so I can remember all of the beautiful features of his face. Johnson & Johnson is slightly different. It uses what's called a viral vector, which cannot in itself cause any problems to our body, to insert that same information that can train our body to recognize the virus. It's supposed to be a 1-dose vaccine. I say for now because some studies suggest that you get a lot more response after a second dose, but we go by what has been approved. You need a booster at least 2 months after the initial dose. Next slide, please. So as far as what about the kids? Currently approved, Pfizer is approved for children 5 years and older. We are anticipating that in the first half of 2022, we will have a vaccine for kids 2 to 5 years old. And anticipated, frustratingly, later in 2022 is the vaccine for 6 months and older. And so we're all waiting for more details on that timeline. Why is it taking so dang long? Next slide, please. I'll tell you why. It's because everything gets studied. Is that the whole slide or was there more? Okay. It's because it takes a whole lot of science to prove that the vaccine is truly safe and truly effective for the kids as well. Why? Let's go back to our shared goals. One of our shared goals is protect our children from harm, right? And so to protect our children from harm, we also have to ensure that the vaccine is truly safe for children. The Pfizer vaccine had already been approved for kids over 12. It had already been approved for adults for almost a year. And what we needed to prove is that it was safe for younger kids. And we also wanted to see, hey, kids are smaller. Will we have the same effectiveness if we give a smaller dose? And so the vaccine for kids 5 to 11 is actually 1/3 of the adult dose. It's a smaller dose for smaller people, but it actually has some more to do with the maturity of the immune system. Kids' immune systems are better, and so it takes less of a dose to get a really good response. And it was actually studied in over 2,000 children for safety and effectiveness. And then because we wanted to go above and beyond, an additional 2,300 children, actually a little more than that, were enrolled for an additional safety group. So we have safety data from the clinical trials for over 4,500 children. Half of them got the vaccine, the other half got salt water. They looked at who got side effects, that they looked at who got protected from COVID. They saw that the vaccine is over 90% effective at protecting against COVID-19 infection, which is awesome. And what they also saw is that, as you can see here in the teeny tiny graphs, there were very rare side effects, and actually some of them were just as common in people who got salt water as they were in people who got the vaccine. Very, very safe. Next slide, please. Did I mention the vaccine is safe? Because I'm going to tell you again, and I'm going to prove it to you. It's been studied extensively for safety and effectiveness in large clinical trials. The ones for adults had about 40,000 people in it, so a lot more because it's just easier to find adult volunteers than children volunteers. Most people feel some mild side effects after the second dose of the Pfizer and Moderna vaccine. I know I did. The serious side effects that get a lot of press are incredibly, incredibly rare, and I will tell you about them. Remember my guiding principles, transparency is one of them. And it was found to be equally safe in children and teenagers as it is in adults. Next slide, please. So, common side effects. Likely to experience this, a sore arm. This is what my husband is talking about, because yesterday was a great day for us. He got his booster, and today he's complaining that he's got a sore arm. It can cause swollen lymph nodes. That's what my mom is complaining about, because she got her booster 2 days ago, and she's like, my armpit hurts. And I'm like, Mom, but you're protected. I'm happy for you. Fever, chills, that's what I got after my second and my third dose. I felt feverish and chills, and I had a lot of fatigue and muscle aches. Headaches and nausea can also happen. These are common. They happen in about 1/3 of people. They're just a sign that the immune system is learning a lesson, that it's kind of working hard to learn to recognize COVID. Next slide, please. The rare side effects, what we worry about, what we don't want, right? These are incredibly rare. They can happen, and so we have to know what they are so we can recognize them if we're that rare person that gets them. And the good news is that they're also temporary and treatable. One of them is called myocarditis. Myocarditis is a temporary inflammation of the heart muscle. It happens in 2 to 3 cases for every 100,000 doses of vaccine given. And it's typically after the second dose. It's more common in younger males, and it typically presents as some shortness of breath, chest pain, an abnormal heartbeat, and it would happen a few days after getting the vaccine. If you've just gotten the vaccine and you're feeling this, go and seek care so that if this is what's going on, you can be appropriately treated. But I don't want to get the vaccine because what if I get myocarditis? Well, let me tell you, if you get COVID, you can get myocarditis too. The myocarditis that's caused by COVID is more serious, it's more common, and it's less easily treatable. So in the balance, I'm picking the incredibly rare chance of myocarditis from the vaccine than the not as rare chance of getting myocarditis when I get COVID. And I say when, because if I'm unvaccinated, it's a matter of when, not if at this point. Allergic reactions and anaphylaxis, which is a serious allergic reaction to the vaccine, has happened. It happens in 3 to 11 cases for every million doses of vaccine given. This is like about as likely as winning the big prize in the lottery. But this is why everyone is advised to remain under observation for 15 minutes after receiving the vaccine. If one has an allergic reaction to the vaccine, they get treatment for the allergic reaction and they recuperate, and then they're back to normal. Next slide, please. So I'm gonna answer some questions that I get often. Question one that I get a lot is, but my kid is healthy, why get vaccinated? Well, let me tell you a few things. One, sure, your kid is healthy, but guess what? 5 million children have been infected with COVID-19 since the start of the pandemic. It has caused almost 20,000 hospitalizations and 4,600 cases of MIS-C, which is a condition that is associated with COVID-19 in children that causes whole body inflammation and can be lethal. It is more common in kids who are Black or Hispanic. Also, the pandemic continues to take a heavy toll on all kinds of facets of children's lives, including their mental and emotional health, their well-being, their social development, their educational experiences. And the way out is really to protect each other in the community. So that's another reason to vaccinate children even when they're healthy. And then here are the reasons that really motivate me. One is that 1/3 of teenagers who've gotten COVID and have needed to be hospitalized were sick enough to be in the intensive care unit. That's really sick, even if they were healthy. And 5% of them required being on a ventilator. That's pretty scary. The other thing that feels really scary to me is that out of the children who have died from COVID-19, 1/3 of them were perfectly healthy and had no pre-existing medical conditions. So it's not enough to be healthy. It really, COVID can really get you even if you're otherwise healthy. Next slide, please. Another thing is, but I heard that it's better to just go with natural immunity. I want to go natural, I'll do natural immunity. What is natural immunity anyway? I don't like that term. Let's call it what it is. It's infection-induced immunity. That means that you have to get infected first to then hope to get some immunity. So let's compare the immunity we can get from the vaccine with the immunity that we can get from an infection. First of all, getting the vaccine is 5 times better at keeping you from getting infected from COVID than having had the infection. Someone who's been infected and has natural immunity is 5 times more likely to get reinfected than someone who's gotten the vaccine. Also, natural immunity is shorter lasting, and the immunity fades away after just 3 months. It's also less predictable. I think that out of many of the things that I'll tell you, this is one that's really important. People who get sick, one out of 3 of them will not develop any immunity at all. Why? We're not sure, and we think that the reason is that the body was so busy being sick that it didn't have any energy or time to develop an immunity at all. So it's a crapshoot. You could get some infection-induced immunity, or you could be back at square one. But what's the risk? Well, to get immunity from an infection, you have to get sick first. Currently, 95% of people who are hospitalized are unvaccinated, and 99% of deaths from COVID-19 in the past few months have been in people who are unvaccinated. Let's think about this in number. About 100,000 people have died in the past few months in the United States from COVID. That means that 99,000 people who died could have been alive had they gotten the vaccine. That's big. So I picked vaccine-induced immunity, and I've been very transparent about that. And these are some of my motivations. Next slide, please. I get this a lot. What is in the vaccine? I want to know. It turns out that the recipe for the vaccine is actually pretty simple. There's that mRNA thing that teaches the body how to recognize the spike protein. There's some fat that keeps it stable. And then sugars and salt that make it so that it will be the right acidity when it gets injected in the body. Not much else. There's no heavy metals. There's definitely no microchip. I hear this a lot. Oh, but there's a microchip in the vaccine. No, there isn't. And if you don't believe me, believe the size of a microchip. Have you ever taken your pet to get a microchip inserted? The needle is gigantic. You could not fit a microchip in the teeny tiny needle that is used to administer the COVID-19 vaccine. Of course, the TikTok thing that there's magnets in the vaccine. No, there's no magnets in the vaccine. The other thing that people have been fearful of is, could the mRNA change your DNA and then change your genetic material forever? That's a good scientific question. The answer is no, it actually doesn't work in that direction. The mRNA cannot work backwards to change your DNA. mRNA lives in the body for a few hours and then it gets destroyed. It's a very short lasting molecule. That's actually why it took so long to create a successful mRNA vaccine. It's because it fades away so quickly. Which brings me to my next slide. It was created so fast. How can you know it's safe? It really wasn't created fast at all. There were women, amazing women physicians like Dr. Corbett and Dr. Turecci, who have been dedicating the past 2 decades to developing mRNA vaccine technology and a vaccine for a coronavirus type of virus. Why? Because one, we knew that an mRNA vaccine could quickly respond to the needs of a worldwide pandemic. So we needed to develop that technology. And two, because SARS and MERS, the last 2 horrible respiratory viruses, were also coronaviruses. So the scientific community was really worried that a coronavirus was going to come about and cause a pandemic. Rightfully so, because it turned out that they were right. So the vaccine was not developed fast at all. There's over 20 years of research behind it. We were lucky that all of this had happened so that when the pandemic hit, we were ready to run, and with the adequate amount of funding, a COVID-19 vaccine was able to be developed as fast as it was. Next slide, please. Some other frequently asked questions. How can we be sure that it's safe for children and families? I've already answered this. It was heavily tested for safety before ever becoming available to our community. Also, after marketing, its safety has continued to be monitored. That's how we have discovered about myocarditis, right? Because it's so rare that it took ongoing monitoring to find out. I think that now we know how safe it is. The other big fear, especially for parents, is what about the long-term side effects? What if there's long-term side effects? I give my kid this vaccine now, and then what about long-term side effects? That's a very valid concern. And this is why I'm not worried. It's because any vaccine side effect happens within the first 2 months of the vaccine. Even if it's something that's long lasting, it appears within 2 months of being vaccinated. So because we have safety data for at least 2 months after the vaccine, well, now we have it for over a year after, because the clinical trials in adults are over a year old. That's why we're not worried about long-term side effects. My family doesn't do vaccines. We don't do the flu vaccine. Why should I do the COVID-19 vaccine? Well, I'd say COVID has upended my life. It has upended my life more than having a baby. And that's saying a lot, because this was rough, the baby thing. It's a very deadly virus. Getting vaccinated against COVID will prevent many infections, long-term symptoms like long COVID, most hospitalizations and deaths. So to me, that's why it's worth getting vaccinated. And why get it if you still might get COVID-19? It's true. The vaccine does not prevent every infection, and it still makes you 8 times less likely to get infected if you're exposed, and it prevents most hospitalizations and deaths from the vaccine. That's a very successful vaccine. Next slide, please. So if you want my advice, get protected. I'm going to answer a quick question, which was, what are medical reasons for not getting the vaccine? There are 2. One is having had an allergy to the vaccine itself, or to polyethylene glycol, which is in the vaccine. Allergies to polyethylene glycol are very rare. Polyethylene glycol is widely used in medications, other injections, as well as in food. And so it's a very, very rare allergy, but if you have it, you shouldn't get the vaccine. And the other is if you've had MIS-C within the past 90 days. There are no other medical conditions that preclude one from getting the COVID-19 vaccine, the Pfizer or Moderna vaccine. Next slide, please. So variants, someone asked, thank you for that assist. Will we be talking about that Omicron variant? Well, yes, as much as I can. So when the way viruses work is they take over our body, right? They come in and then they use our body to make more and more copies of themselves so that then they can spread into other bodies. And when they do that so fast and so excitedly, sometimes they make typos, and those typos are called mutations. And when enough of those mutations accumulate, then it's called a variant because it's different enough from the original COVID-19 virus. Sometimes the mutations make the virus more weak, and then that virus doesn't win the competition and we never hear about it. Sometimes the mutations make the virus more contagious or more serious, or which is the greatest fear, less responsive to the vaccine. Those are more concerning variants. Delta was much more contagious than the original COVID. That's why we saw such a huge spike, especially in unvaccinated people this past summer. It's because it was so much more contagious. It was compared to chickenpox in terms of contagiousness. And most of us have had chickenpox and know how contagious it can be. This Omicron variant, why are we so worried about it? Well, it has 32 different mutations. That's a lot of mutation. And there's a lot of mutations in areas around that spike protein, which acts as a lock and key and is also what we use to teach our body to recognize the virus. So what we do know is that it appears more contagious. What we see in South Africa is that Delta, which is used to be the most contagious thing, was winning out, and then as Omicron took over, the spread of Delta tanked and the spread of Omicron increased because Omicron, being more contagious, won out over Delta. So we know it's more contagious. It can spread more rapidly. What we don't know yet is if it's more serious. It will take at least 2 to 3 weeks to know that, because to know if it's more serious, we look at hospitalization data. And what we know is that hospitalization comes 1 to 2 weeks into being sick. So we only have that information a couple of weeks after we start seeing an increase in cases. Same with death. Those unfortunate people who pass away from COVID, it usually happens within a couple of weeks into the disease, which is why information about death lags behind information about infections. The other thing that we don't know yet is if the vaccine is, if the Omicron variant is more, evades our immunity and therefore might be more resistant to the vaccine. We don't know that yet. I still think that it's important for everybody to get vaccinated. Why? We still have a big Delta problem in this country. 2, it's very likely that even if the Omicron evades immunity, the vaccine still provides some degree of protection. 3, because especially with the booster, it's boosting our immune response so that we are ready and we are creating a wall of protection in our communities to hold against Omicron. So this is where I think back to those layers of Swiss cheese though, right? I'm like, I'm vaccinated, I'm boosted. My husband's vaccinated, is boosted. My baby is not. So what are we gonna do? Well, of course, we're going to continue to wear masks. We're going to really avoid gatherings. I'm still gonna see my parents for Christmas. I have not seen my parents in a really long time, and they need to see the baby, but they're gonna get rapid tested, especially because they have to travel from Jersey. So they're gonna get rapid tested several days in a row after they come, and they can yell at me all they want, but that's how I'm gonna keep myself safe. And then, am I gonna see friends? I don't know, probably not. Maybe to give them a gift, but I'm gonna do it outdoors. That's what I'll do. And that goes to that idea of layering protection. I know I've talked too much, Jennifer, so I'm gonna shut it and see if there's any questions, and otherwise leave it to the other presenters.
No, I appreciate that so much, Dr. Spinazzi. You had a great presentation, and I'm sure people were really engaged. I just want to call on Lisa real quick before we go into the Q&A, just to share an additional resource related to the Omicron variant, and just to say a quick word because we love you, Lisa.
I'll be super quick. Just wanted to share this fact sheet that I think came out maybe a couple days ago on the Omicron variant from the California Department of Public Health. It's very accessible, pretty easy to understand. So take a look at that. And I also just wanted to thank Dr. Noemi Spinazzi for this presentation and for doing our Doc Talk, the partnership that we have, which is going to be next week in partnership with ACOE and UCSF and the Healthcare Services Agency. So definitely check that out on Tuesday of next week. And I think that's all I wanted to mention. There's some resources at the end. Please take a look at those resources. We have a new childcare toolkit, and there's some vaccine clinic flyers, and that's all I'll say because I know we have more to cover. And happy holidays to everyone.
There was one question in the chat,
okay.
Jennifer, that I thought would be helpful to get to, and it was like if the question about can you mix, if you got vaccinated with Moderna, could you get a Pfizer as your booster? And I know that's changed over time, so.
Yes, you can. And more data shows that it's totally effective and equally effective. And yes, you can. So you don't have to worry too much about finding the pharmacy that does the exact same booster as the first one you got. There was one study that suggested that mixing and matching might even kind of help your immune system get flexible a little bit. But yeah, the Pfizer was the booster that was available for me. I had Moderna as my primary series. I just jumped at the opportunity to get a booster.
Maria, thank you for that, Dr. Spinazzi. Do you have a question, Maria?
Yes, I wanted to ask, and I'm kind of nervous about it because everybody says that they have side effects with the first, the second, or the third. I got the booster. I never felt anything, even with the first one or the second. Everybody in my family, they had side effects and everything. And then everybody says, oh, if you feel anything, side effects or anything, is good because it means that it is working. But what about me? I didn't feel anything, not even nothing, just my arm the second day a little bit, and then that's it.
That's okay. That's okay. It's about a third of people who report side effects. So that means that there's 60% of people out there that are just like you and don't feel side effects. We are at this time not worried that there is a change in immune response. I just think that people who get side effects, if you're like me, and you get some side effects, you're like, ay, Dios mío, I'm so tired, I'm sick, and we complain, versus those who don't get anything, they don't go around saying, I don't feel anything, you know? And so I think that there's a lot more people like you, Maria, who are just not as vocal as those like me who want sympathy, but it's totally okay, you're fine.
Good, because when I got my booster, it was during the day and I was working, so I can't just came back to work and still keep working. And everybody thought that I should have asked for the day off.
You're superhuman.
Yeah, you are. You were in that cape. We know our providers wear capes around these parts. Nancy, I see your question on boosters. We have actual page on the resources that will showcase where you can get a booster shot at, provided by our county, outside of whatever medical provider you might have. All right, we are short on time, so I want to be mindful of that. I'm gonna pass it along to our friend Vincent, who will talk a little bit about rate increases to be expected this January. So, Vincent, welcome. Thank you for joining us, and take it away.
Yes, hi. Thank you. Good evening. Thanks for having me. My name is Vincent Pastor. I'm the payment manager at Four Seas of Alameda County, and tonight I'll be talking about the rate increases that is scheduled to take effect on January 1st, 2022. So first, next slide, please. So a little bit about the acronym here, RMR, and what it is. RMR is the regional, what we call the regional market rate ceiling, which is the maximum amount childcare providers can be reimbursed from the state for subsidized childcare. They apply to all of the voucher based programs in California and are determined through the survey conducted every 2 years. The survey measures the cost of childcare across zip code groupings that have the same or similar socioeconomic characteristics such as housing costs, population density, and employment rates. RMR ceilings are then based on the aggregate of the survey data for each county. Beginning January 1st, 2022, the RMR ceilings for licensed providers will be established at the 75th percentile of the 2018 Regional Market Rate Survey. For license exempt centers, which are our FFNs or family, friends, and neighbors, they are the providers who are non-licensed. They will be reimbursed at the 70% of the family childcare home ceiling. This includes hourly, daily, weekly, and monthly for both full-time and part-time reimbursement rate categories. Um, for the for the ARPA, which is the American, in accordance with the federal requirements for childcare stabilization grants, or ARPA, rate increases and supplements are being funded by American Rescue Plan Act of 2021 Childcare Stabilization Fund. This survey will determine the eligibility for the fund allocation, which includes but are not limited to number one, the rate increase, stipends, payment for secondary providers when the primary provider is closed due to COVID, and reimbursement for childcare based on certified hours of care rather than attendance. For childcare providers um, who are expecting this funding, they are asked to complete a one-time survey through the ARPA link. They must complete the survey per license number for licensed providers. They must complete a survey per license numbers, and operating multiple sites must complete a survey per each site. Providers who have already completed the survey for stipends do not need to complete an additional survey for the rate increases. The link is available, and I can actually share that on chat later on, so you can click it. Um, this link is from the CDSS website, and it contains the 3 surveys with different languages available: English, Spanish, and Chinese. Also available in that link is the hard copy format for individuals who are unable to complete the survey online. It also contains the helpful FAQs or frequently asked questions. Next slide, please. So for the rate increases, pursuant to AB or Assembly Bill 131, licensed childcare providers may alter their rate levels for subsidized children only as needed, and shall provide the AP agencies and RNR agencies with a copy of their updated rate sheet. Updated rate sheet shall be made effective within 60 days of submission. So this allows the agencies to, if you turn in your rates updates now, this would allow agencies to make it effective January 1st, just in time for the RMR increase. So just a visual on what that looks like, what the RMR increase looks like. Here we have in the blue, we have the current RMR right now, which is effective until December, end of December. In the green, we have the current RMR for or the 2022 RMR for Alameda County. So just for visual here, if you, I'm not sure if we have any FFNs in the crowd here, but if you notice, look the trust line relative maximum reimbursement rate, which is at the bottom of the bottom table right here. I actually small. So part-time hourly for FFNs for infant, I think that says 474 for infant, and it increased to 1184. So that's a pretty significant increase that we have experienced, that we haven't experienced in a while. For infant, I believe that's $6 something. It increased to 1161 or 1151. And for school age, it's a little below $4 currently, and it increased to almost $9. So it's a pretty good rate increase that we are expecting in January. And I think that's it. Next slide, please. Do we have any questions?
Do we have questions from any of our providers? Want to do a little woot woot for Miss Nancy Harvey and the team for doing so much advocacy. She's been everywhere and chatted with everyone. She's been to our planning council. She is active and been working hard for our county. So thank you for that. And just want to make sure that you have the information and understand what you should be anticipating. So essentially what I heard is getting that, getting your rates updated as soon as possible so that it becomes effective as soon as the rates go in. That will be a huge piece. Any questions for Vincent? We also have some folks from other from our RMRS who might be able to provide, or alternative payment agencies, I should say, who can provide some insight. All right, Elaine, I see your hand up.
Yes, I do have a question. I wanted to know, as far as these slides and the meeting tonight, will we be able to get an email and print all of this out?
Absolutely. So this presentation is in one. We'll get this consolidated into a PDF. It has all the active links that we're sharing this evening. So we'll get that sent out to you.
Thank you.
Absolutely. Any other questions? And if not, we'll get going to our next presentation, which is Michelle. Michelle, you ready?
I am. So just quickly, we are on the emergency response team, childcare response team, worked with Samuel Merritt University to support student nurses from Samuel Merritt to come in to childcare providers and help with consultation. We are on our 14th cohort of student nurses coming out. We have 48 student nurses that are ready to come out on January 3rd, and we're looking for additional sites. This is an extra large cohort. Usually the cohort's about 24 students. We have 48 students coming out in January. So we're looking for sites, and we have this testimonial. Much better for you to hear from actual providers than to hear from me about the program. So Jennifer's going to play this interview with you. For you.
All righty. Please let me know if there's any issue with audio. Shake your head if you can hear it.
Hello, this is Michelle Rutherford, and I'm here representing First 5 Alameda County and also as a member of the Alameda County Child Care Emergency Response Team, who helped form the Health Heroes program. Today, you're going to hear from some of the center directors and a family child care representative who have been participating in the program and can talk to you about some of their experiences.
I have a kid who is very scared of doctor's office. Every time he used to go to the nurse's office, he used to cry a lot. But when the nurses started coming in, one change that the parents told me they saw was he would smile, get a shot, and get done. You know, like he wouldn't cry, he wouldn't be scared, he would blabber with them and smile and say bye and everything. So that fear went off. Then when they saw Jason, one of the kids came to me and said, "Shruti, do you know boys can also be nurses? We can be nurses too when we grow up." And I was like, in any profession, there can be girls and there can be boys. It's just that you need to love that profession. I said, "I want to be a nurse." And I looked at him and I was like, "You're scared of needles? No more."
They did some more in-depth exercises about germs, which was really good. We followed it up with a black light exercise to help them really see where germs are and how they lie. And it also helped the elementary students to understand, which I don't think they did before the student nurses came out, why we were doing the things that we were doing.
We were learning about germs, and especially this COVID-19 virus, and the nurses were telling us that it's everywhere. So they came into the classroom when the children weren't there, and they threw those little art pom-poms, and they're kind of rainbow colored, and they were everywhere in the classroom. And the children walked in and they're like, "Oh, what is this?" And the nurses had them hunt for germs, and these were the pom-poms. And it was the most fun activity. The children really got a visual example of germs are everywhere. And even a few months later, we were still finding them. And the kids were like, "Oh, another germ! Wash your hands!" So that was really fun. And again, each student brought their own talents and gifts, and it was delightful.
The fact that they understood that gender equality is everywhere and every profession has men and women both. That's different, that we see women more in certain professions than men, but it's not that men don't enjoy that profession, you know. So that was a learning curve for a lot of my kids who were there at that time, that men can be nurses too.
The thing that I think was so incredible about the student nurses, when I first explained it to my staff, they also had this laid back kind of view. You know, I don't know if they're coming, what are they going to do? But they came with such enthusiasm. It was just so contagious that they would come and that it would become a partnership for everybody to do the best thing for children. And that's what we got from them. And it just made us excited every time we have a new program out, because we were all together. It was teamwork on behalf of children. And here were these extra people who were going to give us some support.
Staff really were enjoying and looking forward to the nurses coming in. And then our families were like, "Oh, are you getting more nurses? And what are they going to do?" And I was like, "I don't know. It's going to be a new and wonderful surprise." So after some time, it was really a positive experience for everybody.
So I can see that was a little, on the Zoom, sometimes when you're projecting a video, it's a little janky, but I hope you got the idea about that. And then we do have a way for folks to just apply directly. If you've already been a site, you don't have to fill out all the extra information. Just let us know that you're interested in this next cohort or the next few cohorts. And if you're new and you haven't applied before, we're really interested in getting an application from you to host student nurses in January. And we're doing the matching for the sites next week, so the sooner the better.
Thank you for that, Michelle. Again, we'll send out the slides with the link on there, but please reach out to First 5 if you want to get signed up and situated as soon as possible. We've heard nothing but great reviews from those who participated. Go ahead, Michelle.
So, hey, Jen, the one other thing I just wanted to mention that I didn't emphasize is that the nurses come with a great language capacity. So if you have a site that has language needs, we encourage you to apply, and we'll match up student nurses that can support some of your families in their home language, or you with your dual language learners.
Perfect. Yes.
Sounds good. Thank you for that. I'm going to try to run through these next. I realize we're just a few minutes over time, but these should go by pretty quickly to get you out of here. So next up, if my computer, I'm going to pass it to Rowena to talk a little bit about the kindergarten readiness assessment.
All right, good evening, everyone. I'll make this fast. So First Five is partnering with Applied Survey Research to conduct a study to better understand the needs of children and families and educators as part of our kindergarten readiness assessment, which we conduct every other year. So to do this, we are surveying ECE professionals that work with children between the ages of 3 to 6 years old at licensed childcare centers or at licensed family childcare programs in our county. The survey is open right now, and we're asking that folks complete the survey by the 19th of this month. It's available in Spanish and Chinese in addition to English, and will take about half an hour of your time to complete. So sorry, it's a little long, but you will receive a $25 Target gift card once you complete. And don't forget to, if you do it, don't forget to complete submit. That's how you will get the $25 Target gift card. So I'll go ahead and put the links in the chat, and that's it. Thank you.
Awesome. Thank you, Rowena. Next up is just if you want to get a sense of this, ACOE has a number of resources related to 5 to 11-year-olds related to the vaccination, just COVID-19 in general. The Doc Talks, the one coming up with Dr. Noemi is in Spanish only next on the 7th. There might be another one after that for English speaking or dual language. But 47,000 children 5 to 11 years old in Alameda County have already been vaccinated. This count gets updated on a daily basis, so feel free to check that out as they come along. Public Health also has a youth vax facts that might be useful to you. So Nancy, you asked about those booster shots earlier, so I'm sharing with you. These are some mobile vaccinations. The county is targeting areas that essentially have the lowest rates of vaccination throughout the county. These are the dates. I know it's a lot, but you can find them on the public health website. They have them listed there. Next up, hopefully you remember we had a reopening website with resources on reopening your center or your family childcare home, along with some resources and best practices. We've updated this. We do have staff that will be maintaining this website up until March 2022, and then we'll do some reconsideration, but still with the vaccinations and all that, we'll have those resources available for you there. And then, contact your R&R agencies. They can help get you connected to all of the things because they have very good connections out in this county. So announcements. Essentially, this is our final check-in that we have scheduled. We know that this has been useful for you, but we wanted to get, okay. So our emergency response team was scheduled to kind of sunset a lot of its work this December 2021 because youth vaccinations for children younger than 5 have still not come out. We will be continuing our work until that has been released to make sure that we're aligning communications related to that. We are effectively working, at least right now, until March 2022. So that's the context that we're under right now. We're essentially in operation as a response team till March 2022 in this road to recovery. So I want to share a poll with you to get a sense of what might be useful moving forward if we do this or not. So on your screen, you should see childcare check-in preference. Should have popped up. It popped up for me. Would you like childcare check-ins to continue? Do you find it useful? Let us know. Just populate your answer and then click submit. That would be helpful. And we'll give this just 1 minute. And in the meantime, while we're filling that out, are there any questions related to the resources that were shared earlier? I know I went through those pretty quickly.
I don't have a pop-up.
Who said that? I'm like, were you behind my screen?
Veronica. Gosh.
Veronica, Dr. Veronica.
Did I miss it? Because I was in the chat box. Maybe that's why.
Well, let's just.
That's okay.
You can send me an email. You know how to.
Okay, that I found it. I clicked on polls. I'll do it. Thanks.
Okay, perfect. All right. Any questions? And if not, perhaps Rowena, let's get this closed and then we can wrap up for the evening.
Sure. So hopefully everyone put in their responses. I'm going to go ahead and end the poll now. And I'll share the results with folks. So it looks like as necessary is.
As necessary wins. Okay, that's good to know. Thank you for that information. So we will keep you posted as things evolve and as we need to convene. I think you're all familiar with how to get in contact with us. On behalf of the Alameda County Emergency Child Care Response Team, we send you all love and care. We thank you for your commitment to our children and our families, not only in Alameda County, but in general. We wouldn't be here without you, and neither would this workforce. So onwards, upwards, have a beautiful, safe, healthy, happy holiday, and we will see you in the new year at some point in time, and we'll be sure to share the slides soon. With that, I bid you adieu. Have a lovely evening, my friends.
Buenas noches a ustedes también y muchas gracias.
Igualmente. Gracias a ti.
Thank you.
Thank you so much.
Thank you so much.
Thank you.
Thank you.
Thank you
Have a
very
wonderful
much.
day.
Gracias.
Gracias.
Thank you very
I
much.
really enjoyed this. I hope you guys come back next year.
We'll be around.
Thank you so much. Lots of information. Thank you so much. And everyone have a blessed holiday, Christmas
Thank you.
and New Year's.
Thank you.
You're welcome.
Thank you.
Thank you.
Good night.
Good night.
Thank you.
All right. Good night. All right. I think I should stop sharing. That's one thing. I forgot about that.
All right. I'm going to go ahead and end it for everybody, Jeff.
Perfect. Thank you so
All
much.
right. Thanks. Good night, everyone.
Thank
Good
you.
night.